to both I smiled, and to anyone who says this I smile, and I let them know that I really feel that they should be going home and seeking the support of their loved ones, not their permission. Because anything, again, that we're doing to improve ourselves, we're doing for ourselves, not for someone's approval. It's nice to have your loved one's support, but I'm sure all of us have loved ones who may have hobbies or who may do things that may cost some money. And so going home to seek approval from someone, I think, is really a wrong approach to this. And so every week I also like meeting spouses of people I'm going to operate on, because we really help them to accept the whole concept of cosmetic work, whether it's surgical or non-surgical, as really part of the self-esteem building. It's like taking your inner self to the gym as well, and giving it the best health that we can.
Right, and they probably wouldn't go back to their spouse and say, honey, is it okay if I start working out at the Y? Well, yeah.
No, exactly. But,
of course it is.
I think too often women think that they have to seek permission to do something that's nice for themselves. Many women who are mothers are also chronic givers at home as well. So there's nothing wrong with wanting to do something nice for yourself for a change.
That sounds wonderful. Now, just another thing that occurs to me is you mentioned meeting the spouse, and the whole time I was thinking of you're talking with a woman and you're going to meet the husband. But on the flip side, what percentage or how would you judge or estimate maybe, how would you estimate the quantity of men versus women that you do procedures on? Is it 50-50, which would surprise me, or something?
15 years ago, my practice would have been 90% women, 10% men. It's almost 50-50 now. I see as many men coming in, and they say as well, it's really not about looking younger. It's simply about looking my best so that I can present myself in the best manner that I can. I think more and more for different job scenarios where there are different people applying for, with the economy being what it was, we are seeing many mature people who have been out of work that are looking at starting new careers. And so when we see people who are ranging in age from 24 to 50, 60 applying for the same job, it's normal for the patient who is in the more senior years to want to look their best, so that they aren't discriminated on negatively because of their age. Most of the time, the increase in age transcends to more experience, and sometimes that gets looked over, unfortunately, because of the aesthetic appearance.
Mm-hmm. That makes sense. And one thing my eyes just fell on as I was looking down at some notes is it's probably not always about, for example, a facelift, or if that's not what you call it anymore, I'm sorry, but it's probably not always about a facelift, but maybe just taking care of some old acne scars that have always been there and, just really bother them. Or maybe it was a cut, or, they were in the military and had, just, who knows, some kind of an accident and just want to take care of other little things.
Sure. Patients come to see us either for two reasons, either to help them with the quality of their skin or excess quantity or gravitational changes. And qualitative improvements range anything from, as I mentioned, unwanted pigment to unwanted spider veins on the face or blood vessels. Acne scars are a great reason for negative self-esteem. So there are tremendous new treatments for softening and blending acne scars. Usually when people look at us, they look us in the eye, scan our face, come back to our eyes. And so qualitatively, we like someone to be able to look you in the eye, scan your face, and for no distinct feature to stand out, to just have a nice airbrushed appearance. I think everyone agrees it's nicer when someone can get by with very little makeup, just either a small amount of powder foundation, but the increase in confidence that we can give someone that lets them then go out without a lot of makeup, when perhaps before they were wearing lots to try to cover up things, it's also very uplifting for patients. So most of the time, people come in for really some what we may think are minor qualitative improvements, but those issues are things that they see when they look in the mirror, first of all. As I said, the laser treatments that we have in the office to help improve tone and quality, to help soften pigment or blemishes, have really come a long way. These are treatments really now that just take 5-10 minutes to do. We can do them just with some topical numbing cream. Patients can put makeup on as soon as they have it done. They stay a little pink for the rest of the day, but by and large go about their regular activities right after the treatments.
And is that something that's ongoing, or is it a one-time thing, or?
Typically, people have to come in for a series of treatments, usually once a month for perhaps 3 to 6 treatments, and then they'll maintain the quality by coming in quarterly, perhaps to maintain, or even a couple of times a year. Other very common procedures that are done in cosmetic offices that I think sometimes have negative perceptions, Botox, cosmetic injections, and other forms of botulinum injections would be the most common drug that we use in a cosmetic setting, really designed to soften scowl lines, to soften the horizontal brow lines and crow's feet. Most people that come in for Botox come in saying, I'm tired of being asked if I'm angry when I'm not, if they have a deep scowl line at rest. And so a tiny injection of Botox can make a world of difference for a patient. And it's really a very safe drug. Starts to work in about 72 hours, lasts for about 3 months. Many popular misconceptions about it that we help to dispel when you come in for your informational sitting.
Okay, and let me just take a quick break here and just remind people that if they've tuned in a little bit later, we are speaking with Dr. Greg Chernoff, who is a world-renowned plastic surgeon, and he has given advice to people all across the world, and people come from across the world to have his procedures done. So he's giving us some insight on what options are, what's new in the industry, and so, Dr. Chernoff, one thing you mentioned a while ago was personalized cell therapy.
Yes.
Can you go back to that? How does
Sure.
that work, and what is it? And by the way, we have 12 minutes left. Isn't that crazy?
Sure. It's called Lviv. Lviv is the first FDA-approved form of personal cell therapy. This means that you're the donor, you're the recipient. This is the first FDA form of therapy where we can take a sample of your own tissue, send it to a lab, and for the rest of your life, really, they can tissue culture or grow your own cells called fibroblasts that make your own collagen. And they send us syringes that have in the tens of millions of these fibroblasts per cc that we can inject. Right now, it's FDA approved for injecting moderate to severe nasolabial fold or your smile line wrinkles. There are some ongoing studies and some studies in the past that utilize this therapy for the treatment of scars that saw some nice results with that as well, and also for lip lines, smile lines. This form of therapy really is unique in the sense that first of all, it's your own tissue. It's not a filler. It are your own living cells that we are re-injecting, which then develop a blood supply and start making your own collagen. It's a gradual improvement. So some patients that come in that in the past had filler put into various areas and didn't like, the one day they had nothing, the next day they had large lips, or the next day the feature was gone, can get more of a gradual improvement, so that really no one will notice the improvement or the softening. And as research continues, as I said, this form of therapy will find its way commonplace, I feel, into treating either linear scars in the face or acne scars. It will help us in our armamentarium of treatments to continue softening scars. But we've seen really an exponential rise in popularity of Lviv in tissue-cultured fibroblasts for the purposes of softening smile lines currently. And patients are intrigued by this, as I mentioned, because it's their own tissue, because it's not a filler, it's not a foreign body, but it's their own living cells that we're putting back into their body. So a very exciting form of cellular